Now what we're going to demonstrate is the water and the effect it's going to have when you throw it on the grease. The most important thing they should not do is throw a wet type material on it, whether it's water, a can of soda pop. All that's going to do is cause that grease to really, once that water hits it, that cold liquid hits that hot oil, it's going to explode. And if you're close by, most people walk up on it, throw on it, and they get burns to their face, hands, and the fire will spread throughout the kitchen. Kitchen fires are pretty significant. We have a lot of kitchen fires. A lot of them are related to people cooking with grease. What you can see is we've used a small amount of water in there. Very small amount. People tend to grab glasses of water or pans of water and throw it in there, and that's just going to make that splatter a lot further, and you can see how high it went up in here. We have, 25-foot ceilings and how high that went up. Now we're going to demonstrate using flour or baking soda and how that's the effect it's going to have on the fire.
Very common burn. We're averaging, I would say, 2 to 3 a week. The tendency is to grab the pan and get it outside. And when we grab that pan, first of all, we splash the hot grease. It generally involves this part of the hand. Dr. Kevin Bailey is going to help us with a little demonstration.
So the idea is that you start moving around, so particularly you pick it up, it sloshes like that, and then it comes back on you like that. And then if you look at the burn pattern here, let me get some contrast up for you for the photograph. That's typically what we see. So unfortunately, these are the two fingers you use for pinch and for fine grasp, and unfortunately the ones you don't need so much tend to be spared.
And if this happens to you,
go to the kitchen sink and run your hand under cool water. You can run your hand under cool water for 5 to 10 minutes. Do not use ice. Don't use ice water. That actually will make the burn worse, because if you think about what ice and what cold does, is it causes your blood vessels to get really small. They constrict down, and so there's less blood going to the area, and that will actually increase the size and depth of the burn. So we don't want to use ice or ice water, but use cool water. Just cover it with a clean, dry dressing, even a clean, dry towel. That will go a long way to helping the pain. The pain is created by air currents that are going over that raw wound. So if you put a towel over it, that will protect it from the air currents. And number two, if you slather it with an antibiotic ointment or other things that you have around the house, the first thing we have to do is we have to wash that off so that we can evaluate the burn wound, and that's painful. We've all heard smear it with butter. We don't want to use butter. We don't want to use mayonnaise. I would suggest that we not use mustard. There is an old home remedy of using tea bags. The reason that tea bags were used once upon a time is tea has tannic acid, and the tannic acid will tan or dry the skin. But those things should not be used. Just if you're going to come in to have it checked by a physician, just wrap it with a clean, dry dressing. It's the best thing to do.